Got a video on another extremely difficult problem, on malaria. It comes from Iraingo Moses from the Oil Health Research Foundation in Port Moresby, Papua New Guinea.
For the last 20 years, we have been hearing that we will have a malaria vaccine within 5 years. Given that malaria has been driven from countries with good health services without the need for a vaccine, how much hope and effort should be placed on the development of a vaccine or new drugs rather than strengthening health services, especially when countries with a large malaria burden like Papua New Guinea have poor vaccine coverage rates and poor functioning health services?
Okay, Bill, we know you work with oil search in Papua New Guinea. The search for a vaccine is what this is about.
Well, in fact, there's very little money being spent on a malaria vaccine. It was mind-blowing to me that when our foundation gave $40 million for malaria vaccine research, we became the biggest funder in the world. And whenever you have a disease that at that time was killing 1 million children a year, now because of bed nets, we're down to more like 700,000. The idea that the world can't take even 10% of what it spends on, say, a baldness drug and put it towards a malaria vaccine seemed pretty stunning to me. And yet the people who suffer from malaria don't have a lot of money, and so their voice in the marketplace is very weak. So only through government research or foundations will we pull that money together. Now, I'm quite optimistic that we understand enough about malaria. We can do what are called challenge models that will eventually come up with one. In parallel, though, we're also coming up with better drugs, and drugs that are far less expensive. There's a drug that's been worked on here in Australia that will be a single-dose drug. And so the compliance, the need to come back to the health service and take the multiple doses, the side effects will be eliminated. So a lot of the innovation lets you do delivery even in very tough places, where PNG is one of the toughest places to deliver health interventions.